Any discomfort here?
Yeah.
Quite a bit. Yeah.
And it's more on the right
right
side. Yeah.
Okay. Here.
Yeah.
More on the right side.
Yeah.
Eh? Okay.
100%.
I'm gonna push down, resist. Feels weak.
Yeah,
painful.
super weak.
Yeah?
Super weak. Yeah.
When I bend your knees, you can feel it in the lower back.
Even now like this.
Yeah?
Yeah.
Okay.
Like 1 point, you know.
The most.
Okay.
1
Yeah.
or 2?
2.
2. Okay.
Sure.
So that's the disc space between L5 and S1.
Yeah.
Okay. Exhale. Inhale. Exhale. Inhale. You may feel a twitch here, okay? Oh, yes, that was juicy. There we go, another one. Oh, yes. Drop your head
crazy.
back. Yeah.
Much better. Much better.
Much better?
Yeah.
Okay.
Before I can.
What's up, everybody? Dr. Ranen here. Today I'm with my friend and patient, Damien. Damien is a long-term patient of mine. I haven't seen him in a couple of months, which is always good as a patient.
Exactly.
But today he comes in with some lower back pain. So Damien has a history of weightlifting, CrossFit. In the last couple of months, he's transitioned into Hyrox, and the kind of mixing the sports has had some effect on his lower back.
Exactly.
So he's having quite acute lower back pain today. Central, but more on one particular side. It's more on the right side, yes?
Exactly.
Okay. So because I haven't seen him, we're going to start with our neurologic examination and then go on from there. All right, let's get going.
Go.
Okay. Okay, everything is working well. Can you feel that?
Yeah.
Same both sides?
Yeah.
Here,
Yeah.
here.
Yeah.
Okay, lift your toes up for me. Hold, hold, good. Hold, good. Bend your fingers down, your toes down, sorry. Hold, good. Hold, good. Okay, straighten your left leg for me, please. Toes towards you, chin down, down. Bend forward. Any pain in the lower back or stretching in the leg?
Stretching in the leg.
Okay,
Yeah.
sit upright for me. Right leg, please. Toes towards you, chin down. Bend forward. Any sensitivity in the lower back? Little bit.
Yeah.
Any stretching in the leg?
No.
No, just
Yeah,
discomfort
just
in the lower
exactly,
back.
yeah.
Can you point to me and show me where? On the hip. Okay.
Yep.
Can you stand for me, please? Let's get your face this way. Okay. Any discomfort here?
Yeah.
Yeah? Quite a bit. Yeah?
And it's more on the
On
right
the right?
side. Yeah.
Okay.
Middle right, you know.
Just bend here. Any sensitivity?
Lumbar.
Lumbar. Okay.
Yeah.
Here.
Yeah.
More on the right side.
Yeah.
Eh? Okay.
100%.
Here.
It's okay.
It's okay. Here.
Yeah. Okay.
All right. Slowly bend forward for me. Any discomfort in the lower back?
No.
No. So it's mainly extension.
Yeah.
Okay. Let's get you on your back for me, please. So how was Hyrox Berlin?
Was nice,
It was
man.
good?
Yeah. Even the race was super nice in the airport. So it's
It was in the airport?
Yeah, in the airport, outside and a little bit inside, you know. And the vibes and everything was super nice. But for me, the race was hot.
Hard.
Yeah,
okay?
really hot, especially on the run.
Leave your leg loose. Any sensitivity in the lower back?
Now, yes.
But yes, on the
Yes,
right side.
Yeah.
Okay.
Oh, left side.
On the left
Yeah,
side,
yeah.
in the lower back.
Yeah.
Leave it loose. Leave it loose. I'll lift it. Any sensitivity in the lower back?
No, I'm okay.
Any stretching in the leg?
Yeah,
Same as the left side or different?
same.
Same. Okay. All right. Hold for me. Hold this leg. I'm going to push down, resist.
Okay.
Good. Turn your foot out. I'm going to push down, resist. Good. Okay. As you lie like this, any pain in the lower back?
No.
No. Okay. Lift for me. Hold. I'm going to push down, resist. Feels weak. Or
Yeah,
painful.
super weak.
Yeah?
Super weak. Yeah, on my fifth flexion.
Okay, leave it loose. I got it. All right, let's try one more time. Okay. Hold. It's not bad, but you're really trying hard.
Yeah.
I'm gonna push down, resist. Yeah, you are trying quite hard, but the power is there. Okay.
At least.
Let's get you face down, please. Let's pop this off. Yeah.
Oh yeah.
All right. Starts at the bottom. Okay, so we do have a small short leg on the left.
Just on the right side, actually.
When I bend your knees, you can feel it in the lower back.
Even now, like this.
Yeah?
Yeah.
Okay.
Like one point, you know. Really here.
On the right?
Yeah.
Okay. Can you raise your right leg from your hip? Okay, and down. Left leg. It's about the same, but this one's slightly short, slightly lower. Okay, let's check out your lower back. And obviously you haven't seen me. Have you gotten any soft tissue work, any cupping, anything like that?
No.
Okay. Okay. Any sensitivity?
Yeah.
Yeah. Any sensitivity?
Yeah.
More.
Yeah.
Any sensitivity?
Yeah, also.
Yeah. Okay, tell me which one's the most.
Okay.
1
Yeah.
or 2?
2.
2. Okay.
Sure.
So that's the disc space between L5 and S1,
Yeah,
okay?
I was thinking.
Yeah.
Oh, fuck. Can you feel here as well?
Which one's more sensitive? Both?
Both, but I can see right side.
Right side.
Yeah.
Yeah.
Yeah. That's both, huh?
Okay. Is this painful
Yeah,
or
it's-
ticklish?
It's not ticklish, it's
Sensitive.
yeah, sensitive, yeah.
Can you feel how ropey?
Oh, fuck, it's even painful.
Painful, eh?
Yeah,
Can you
yeah.
feel how ropey that is?
Yeah.
That is your external oblique on the top, and then your internal oblique and your transverse abdominis. So this, all the muscles here are guarding.
Yeah.
Tight?
Yeah.
Yeah. Have we treated your lower back before? Do you remember?
Say again?
Have we treated your lower back before?
no.
I don't think so.
No.
No. Okay.
With you, we did shoulders. remember?
Shoulder, yes,
Yeah.
shoulder and neck, yeah.
But yet, little bit as well, lower back.
Lower back,
I
okay.
remember.
I'm gonna push down, resist for
Okay.
me, please. Good. I'm gonna push down, resist for me, please. Okay. Leave it loose, I'll lift it. Okay, squeeze your glute, hold. Good, relax. Leave it loose, hold, resist. Ooh, no. Okay guys, so I've just examined Damien. I've also explained to him what I think is going on. He has quite significant sensitivity at L5, S1, in particular the disc space between L5 and S1. He's got a weak glute max on this side, and in general his pain is right-sided. So I think that he has an irritation of the disc with small nerve root compression, which is why he's having this migration of pain around the hip and weakening of the glute max. He also has a positive nerve root compression test on the right side. So we're going to go ahead and decompress his lower back. We're going to do some intramuscular electrostimulation, the glute max, the hamstring, the superior cluneal nerve, the lateral branch of the iliohypogastric nerve, which is what gets the transverse abdominis to fire, which is a big stabilizer of the core. We're going to work a little bit on the thoracic muscles and end with some manipulation. If you like what you see, please hit the like button. Please subscribe and drop any comments you may have in the comment section below. Let's get going. Damien, you know, you have the most views on our channel.
Really?
Yeah, I think it's like the last video we did like 600,000 views.
Whoa, no way.
Yeah.
I was stopped at like 30k, something like this.
No, bro.
Oh no, fucking way, good.
Yeah. So you're a superstar. You're a superstar on the channel, bro.
Good for you.
All right. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. And rest. You good?
Yeah.
Okay, inhale and exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. And rest. Any sensitivity when I do that?
It's okay.
Do you feel it stretching?
Yeah.
Yeah? Okay, inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. And rest. So when's your next competition?
In September.
September, okay.
Yeah.
So you have some time to recover, yeah.
I take the sweet time for it. I need to fix first.
Yeah. Okay. Let's just check the leg length, yeah? That's perfect. Okay. So you're not doing CrossFit at all anymore?
No, I stopped.
You dropped one drug and you picked up another drug.
Exactly. And I give to my clients as well.
Yeah.
So now I'm like blocked because all my clients want to do
Hyrox,
I have to do it.
Yeah, I had a bodybuilding coach come in some time ago, and he's transitioning to full Hyrox because he's like, my clients are all participating in Hyrox.
Exactly.
I have to be proficient in this now, you know?
Yeah. It's part of the job.
It's part of the job, bro. It's part of the job. Yeah.
But at least all the station, all the exercises is not so hard for the body at least.
So explain this to me. You have a set.
You have 8 kilometers run.
Oh, 8 kilometer run, okay.
8 kilometers run, and between each kilometer, you have one station, one exercise.
Okay.
So like you do 1K run, 1K ski.
Okay.
1K run, 50 meters sled push. 1K run, 50 meters sled pull. 1K run, 80 meters burpees bob jump. 1K run, 1000 meters row. 1K run, 200 meters farmer carry. 1K run, 100 meters sandbag lunges. 1K run, 100 wall ball.
Okay. And that never changes. That routine never changes.
Yeah. Only the weights changing. Like you have two you can say like open and pro.
Okay, got it. It's like pretty much in CrossFit where you scale.
Exactly.
Yeah.
So at least you need endurance. At least it's like 80% endurance, but there's not too much strength training.
Okay.
So it's good for the runner at least. If you're a good runner, you're going to be good on Hyrox. Because the run is like 70%, 60-70% of the race.
Man, that's a bit too much running for me.
Man, 8K, to be honest, I tell you, like when you're doing in double, in duo, it's really nice.
Yeah.
Because you are with your partner.
You can split the run when you in doubles? No. Okay, you both need to run 8 kilometers.
Exactly, but you split the exercise.
Okay.
So at least you have some rest time.
Yeah.
And it's more.
You
like,
can recuperate.
Exactly.
More recovery time.
Exactly. It's even like a little bit high intensity, higher.
Yeah.
Than alone, but it's funnier, 100%.
All right.
Alone, man.
We're going
just suffering.
Inhale. Oh, you can see the big reflex there. You may feel a twitch here. Okay.
Yeah. Oh.
You good?
Yeah.
Great. Sensitive?
Sensitive.
Okay, take a deep breath in. You may feel a twitch here, okay?
Mm-hmm.
It's okay?
Yeah.
You still splitting your time between France and Dubai?
Exactly. Yeah. Look, I'm gonna travel in 2 weeks. I'm Travis. 2 weeks.
2 weeks.
Yeah.
To back home.
Back home. Yeah, until end of September.
Okay.
Yeah. Ah, come on. You see today it's 50 degrees.
Yeah, man. Oof.
And you know, like 90% of my clients traveling as well.
They are traveling. Yeah.
So it doesn't make sense for me to stay.
That's true. That's true.
I'm follow them in the trip in south of France, Europe.
Yeah.
Yeah.
And last time I saw you, you went to visit your sister.
In New Caledonia.
New Caledonia. Yeah.
Yeah.
You got any other trips planned?
No, there no.
No.
It's too far.
Too far, eh?
Yeah, brother. It's 20 hours trip.
You haven't been to Mauritius or Reunion?
Never. I have to.
I think so.
Yeah.
It's far from here, but it's 8 hours. It's a little bit better, you know?
It's much better.
Much
it's
better.
20 hours New Caledonia.
Yeah.
So.
It's like other part of the world.
Yeah.
Yeah, because it's near Australia, right?
Exactly.
In the Pacific Islands. Yeah.
You do like Dubai, Singapore, Numia. Like it's like 9 hours and 8 hours of flight.
So your hamstring is fine, it's firing, but I'm gonna work on it anyway,
Yeah.
just to offload some neural tension.
Yeah.
You good?
Yeah. If you need, I can.
No, it's okay. It's okay, I got it. Okay, the back may be a little bit sensitive. Just bear with me because your muscles are very hypertonic.
Okay.
Inhale. Ooh. Great. Ooh, got a bit of a twitch there. You all right?
Yeah.
Okay, we're done. You still single, bro?
Of course, brother. What I can find Dubai. In 7 Gym, you know 7 Gym?
I do.
You know the girl in 7 Gym?
I know. So,
No, but I'm good single, to be honest.
yeah?
Yeah, I'm still young, 29, but I have a lot of projects in my head.
Yeah.
So
All right,
I'm focused on the other things. Yeah.
we're gonna switch the needles on now. You feel that in your leg?
Yes.
You
on the
feel it in
right.
your back?
Back no.
All right. How's that in the back now?
Yes, I start to feel.
Light, mild, or strong?
Light.
Now?
Still light. Okay.
It's okay?
Yeah.
All right, in the leg?
Leg, yeah. Okay.
It's okay?
Yeah.
All right. Okay, guys, so how I met Damien was we were all training at the same gym here in Dubai called Train SF. And I treated a friend of his and a friend of mine, David Nizovic. We've been trying to get David in here to shoot some content and do treatment, but he's also a very busy man. And also recently in love. So, hey, Damien. Yeah, David is in love now, so it's hard to get him.
We lost him.
Yeah, we lost him. So we basically have a big group of colleagues or friends, you can say, that work together, and we help to co-manage patients together. And this is the best way as a patient to get through your injury, because often what would come in is what would happen is patients would come in and I would have no communication with their PT, and we weren't able to manage the injury through the exercise. Now by collaborating with guys like Damien, David McCall, who you guys would have seen on the channel, Scarlett, Harvey, by collaborating with the PTs, we have a better communication system. They don't lose a client, I don't lose a patient, and we're all able to work together well. So make sure you find yourself a coach that is working with someone or has a good network. It's really important. You good there, mate?
Yeah.
Too strong in the back?
No.
Okay. Oops, had a jumper. The muscle was so tight, it just pushed out that needle. Okay, take a deep breath in. Ooh, there we go. Okay, let's test out your glute here. Lift your leg, squeeze this buttock, hold. That's much better.
Yeah, much better.
Okay. Let's get you to stand for me, please. Turn to your side first. Slow. You okay?
Yeah.
Need to get some sleep. Let's get you to turn. I just want to see how your lower back feels now.
Much better. Much better.
Much better? Yeah. Okay.
Before I couldn't do that.
How's that?
It's sensitive.
Sensitive, yeah. Here?
It's much better.
Much better, okay. Sit for me, please.
I'm there.
Yes, please. Okay. Straighten your left leg now, toes towards you, chin down. Any sensitivity?
I can feel on my lower back.
On your lower back, okay. Right side for me. Chin down. Any sensitivity on the hip?
No.
No, just in the hamstring?
Yeah.
Okay, so we've been able to reduce that nerve tension. Let's get you on your back for me, please. Let's test out your strength now. So if you guys can recall, when we tested out Damien's hip flexor and quad, the power was there, but it was really struggling to engage the muscle. So let's see if it's any better. Hold for me. Hold. Much better,
Much better.
Yeah, turn your foot out. Hold for me. Hold. Yeah, much better.
Yeah.
I think while we're here, we'll work on it because I can still see to a degree you are still trying a little hard. So let's work on it. So what advice would you give to someone starting Hyrox, transitioning from weight training, and mainly advice on trying to create balance and prevent injury?
Many advice. So it's at least the first advice is to start the running.
Start the running.
Yeah, because it's the first things you have to do it for the Hyrox. The means exercise. So yeah, running, and then you have to add some strength training, but about like to be better on your run as well.
Okay.
It's like core workouts. Yeah. Hip flexion, hip mobility.
Okay. So strength and conditioning for the run.
Exactly.
Strength and conditioning for the run. This is important.
Yeah,
this is very important.
Because the people think about only running, but you need to work
your muscles
to be better on your run.
There we go. This is very important, guys. Even runners themselves.
Yeah.
You ask a runner like what strength and conditioning you do. They say no, nothing.
Yeah, exactly.
All I do is run.
Exactly.
And then they develop these chronic hip, lower back issues, knee issues.
Yeah.
So strength and conditioning is very important.
Exactly.
Even if you're just a unilateral sport or a singular sport.
Yeah. So you have to add some exercise like Bulgarian split squats, single legs RDL.
Yeah.
All of this kind of exercise is going to be good to be strong and to be better on your run. So this is my advice. Yeah.
And what about guys transitioning from weight training? Earlier on when we were talking, you mentioned...
So at least you don't really need anymore to lift heavy. Yeah. You just need to lift smart. Yeah.
Okay.
So it's like we said, it's improve your running, improve your endurance on the exercises, like on the push sled, be able to push 200 kg on 100, 200 meters to build your endurance, your strength endurance. And like a wall ball as well. You have 100 wall balls. It's like work on your military press, for example, on the trench, but as well, on the endurance, lightweight and lot of repetitions.
Okay.
So it's a balance. You have to work your strength and your endurance in the same time.
Yep. Hyrox is taking over the world at the moment.
Yeah, man, it's crazy. Like the strength, especially in France. I can see in France. Other people like think about only Hyrox now.
Okay. Deep breath in and out. So right here we are in the psoas muscle. You okay?
Yeah.
Not too strong?
I don't feel, to be honest.
Now you feel it.
I feel, yeah. Now it's good. Yeah. Off.
Too strong?
It's limit.
Better?
Yeah.
So the reason why I wanted to work the psoas muscle in Damien, even though the muscle strength is better, is that psoas is a primary hip flexor but secondary lumbar stabilizer. And if it's overworking to hip flex, like in the run component of the Hyrox, which Damien was having trouble with during this last event, it's probably not going to do its secondary role as a lumbar stabilizer. And if he does have a lower back injury, we need all the muscles that are affiliated to stability work to be working. So even if I give it an extra 10-20%, if it's at, let's say, 80-85%, that's fine. You know, we get it up to 100. And the reason why we're going to work the quad is because if the psoas has been overworking to hip flex and switches off, the quad's going to hip flex and extend the knee. And over a period of time, it's going to become inhibited. So you have multiple muscle group inhibition, and we don't want that. You good?
Yeah.
All right. Done. Okay. Let's check this out, see what the strength is like now. Lift up for me. I'm gonna push down, resist. Oh, that's much better.
Yeah.
Turn your foot out, hold. Good.
Yeah.
Okay. All right, let's get you to sit for me, please. Scoot down on the bed. Okay. Lie back for me. You have a busy week?
At least now, I'm not working like before.
Okay.
I'm working a lot on the morning, like from 7 to 2.
So you're not working like a dog, like a slave anymore, no?
No,
Yeah.
done. So I have like still last 7 clients a day.
Yeah.
But from 7 to 2 p.m. and when I stop, I focus on my workout.
Oh, nice.
And I go home.
Yeah.
It's nice.
There we go. This is what you call work-life balance.
Yeah.
Lift your head for me. Okay, leave your body loose, 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 loose. I got you. Oh, yes, that was juicy. There we go, another one. Oh, yes. Drop your head
crazy.
back. Yeah. Turn your head to the right for me. Other right. Ooh. Okay, they're all gone. All right. Let's get you to sit up for me. Swing your legs over. That's what happens when you don't get treatment for like 1.5 years. Yeah. All right. Okay. So let's get you to straighten your left leg now. Toes towards you, chin down. How does that feel in the back?
No,
Nothing.
not anymore.
Right leg. Toes towards you, chin down. How's that?
It's much better.
Much better? Yeah. All right. Great. Okay, guys, so that brings an end to our session today. As you can see, Damien is a hyper responder to treatment, and we have patients like this. They come in with acute pain. Like just before we started the session, while he was sitting here, he was like, my back's killing me. So we cut our conversation short and we got to the treatment. But as you can see, he's a hyper responder. These patients are few and far between. So don't leave your issues till too late, because it may not take one session to fix everything or resolve most of your pain, right? So we're going to get Damien, regardless of how he's feeling now, we are going to get him back in a few days, and watch out for part 2 of this video. Damien is a VIP coach here in Dubai. You know, he treats the all the beautiful people of Dubai. So if you'd like to train with him, Damien, would you like to share your information?
Okay. My Instagram is damien.crb. And yeah, you can find me in 7 Gym. Actually, I'm working there every day.
All right, guys. So thank you very much for watching. Please follow us for Damien's journey over the course of the next week.
It's always good to see him, to be honest. Thank you for your knowledge and to fix me.
No, it's only a pleasure. All right, guys. If you like this video, please hit the like button. Please subscribe and drop any questions you have in the comment section below. Take care. Thank you, my man. Thank you.
Thank you too.